arriving in the next 3 weeks, and that's great news. But we all know that much, much more is needed as well, both for individuals and families, and for a lot of our nonprofit organizations who are trying to survive during this so that they can just help people the way that they do, in particular, the most vulnerable members of our community. So, knowing that was all going to take place, about 2 weeks ago, we launched the One Louisville COVID-19 Response Fund. And this fund, like many great things that happen in our city, is a partnership. A partnership for One Louisville includes obviously Metro Government, Center for Nonprofit Excellence, Metro United Way, the Fund for the Arts, Humana, LG&E, Brown Forman, Land Tech. Goes on and on and on in terms of the number of folks coming together, the Community Foundation of Louisville. The One Louisville COVID-19 Response Fund was put in place to support both individuals and families in distress and community-based organizations that need help as a direct result of this outbreak. So if you've been watching these daily briefings, you might recall that the original goal was to announce the fund, and the goal was to have $2.5 million in the fund. Well, we blew by that. So we announced the fund with $3.6 million. And then the money kept coming in. So several days after that, we said, let's announce where we're at. So about a week ago, we announced that we were at $5.6 million. So 3.6, $5.6 million. So I want to give an update today that the fund has grown to over $7.4 million, which I think is just like awesome. We have really shown the country on how a city can come together. Yes, we talk about us being a compassionate city all the time, but if it's just talk and no action, it's no good. If it's just all lips and no hips, the movement, it's no good. So what we're seeing here is tremendous response from our citizens. These are gifts big and small, from $50 to $1 million. So everybody can help in this. But I couldn't be prouder of our response from the community, and it's still coming in. So thanks, everybody. You can go to louisvilleky.gov, the homepage, click on the top left, and you'll see how you can keep contributing. So whether it's $10 or $100,000, please, you're really helping out and helping people in need. As a matter of fact, last week I mentioned 128 households already whose applications have been approved. So that means those 128 families, average checks total going out are about $800. That money is going to bills that they have from landlords, from utilities, child care providers, to help them fill this gap during this really difficult stretch. And so there's going to be a lot more of those as well. We're getting literally thousands of calls, and we're processing them as fast as we can. So that's the direct assistance side. There is the nonprofit side also. So today, I'm excited to announce the first round of nonprofits that will receive funds from the One Louisville COVID-19 Response Fund. There's 17 organizations, and they are Americana Community Center, Apron, which was founded to help independent restaurant workers, the Association of Community Ministries, Catholic Charities of Louisville, the Center for Women and Families, Dare to Care, Family and Children's Place, Goodwill, the Jewish Family and Career Services Center, Kentucky Refugee Ministries, La Casita, the Lee Initiative, El Home, the Louisville Urban League, the Neighborhood House, Salvation Army, and Volunteers of America. So those are the first 17, and there will be more coming, much more coming. So congratulations, and thanks to all these organizations who do such good work in our community. And thanks for our team at One Louisville, the advisory board that has selected these nonprofits using data and community experience to send these funds to folks we know are going to help a whole lot more people. This is a really outstanding group of nonprofits that serve our most vulnerable in the community, and they have been long proven partners of the city for quite some time. I'm happy to say I'm joined now by one of these great city partners, and that's the Louisville Urban League, and their president and CEO, Sadiqa Reynolds, is going to share a few thoughts with us. So Sadiqa, thanks for joining us today.
Thank you so much, Mr. Mayor. It's an honor to be here. It's nice to see you always. You are helping to keep us all calm, and we are very thankful for the way you're helping our city, leading our city through this process. Thank you to everybody over there at Louisville Metro. Obviously, you all know that the Urban League's focus remains the same: jobs, justice, education, health, and housing. And what we are finding now in this time is that people are needing us more than ever for things like gas. There are people who are still going to work, and so they need gas cards sometimes in order to do that. We're helping there. Medicine, we have some pharmacies and insurance companies that have approved multiple months of medicine, but people cannot necessarily make those copays. And so we're helping with those things as well, certainly with groceries, also in some instances, grocery runs. What I'm so proud of with our team is that we have been able to move all of our services to online services. So our classes are still going on. We're still doing our financial empowerment series. We're still doing coaching. I think it's probably even more important now for us to continue that work than it was before, because you have people in some cases who have spent maybe a year saving money in order to be prepared for the down payment on that new house. And right now they're maybe finding themselves in a position where they've been laid off and they may have to tap into some of those savings. And so trying to deal with some of the emotional part of this as well. Of course, the population we serve is very they're already at risk for a lot of reasons. One, of course, because of the significant number of underlying health issues in our community, but then also the reality is that people who already were suffering financially continue to suffer and will suffer as this proceeds, this pandemic is stretched out. And we don't want them to have to worry about money or groceries or any of those things. We want them just to keep themselves safe. And so we are still acting as that safeguard in community, sometimes helping to move things a little bit faster, maybe reaching out to TARC when we hear that we've got people waiting for bus rides, or, just whatever we can do, everywhere we can do. There was some confusion, I think, at one point. Excuse me, the water company had definitely agreed for no shutoffs, but unfortunately they couldn't stop the notices from going out. And so we wanted to make sure that we let people know that they were not going to shut their water off. That was just a timing issue. So we're really trying to help be a conduit for some of the communication with our clients. Just on a Generally, in a year, we have anywhere from 18,000 to 23,000 visits at our facility. So there are a lot of people who regularly rely on the Urban League, whether it's tax services, which are going to start again online. You can check the Urban League's website for that. We do that in partnership with Louisville Metro and the Asset Building Coalition. So I think that's a very good thing. I happen to be in a room right now where if you don't move, the lights turn off. So I'm just going to have to move occasionally. So I'm back. I just did that. I did, right in front of the whole world or whoever's watching this. Um, there are lots of other things that we are engaged in, just trying to ensure that people in this part of the community and all over the city, because the Urban League happens to be situated in the West End, but we serve people across even our state lines. I mean, we're in Southern Indiana and even other parts of Kentucky, particularly for our Urban Senior Job Program. We were very thankful to the National Urban League and the Department of Labor for being able to work out an agreement for us to be able to pay our seniors their stipends. We have 114 senior citizens in this community who were counting on those stipends. But as organizations began to close and companies began to close, we had to make sure that they still had the resources that they needed. So those are some of the things that we are doing on a regular basis, just to try to ensure that our folks are still, um, just able to sort of do what they had been doing to the best of their ability while also isolating And one thing, Mayor, that I know you talked about, I heard, I didn't get to see you, but a lot of people have told me that you talked about the community hugs that the Urban League is doing, 2 o'clock, not actual hugs. So phone calls are the new hugs. And we're doing that because we know there's a significant number of people that are home alone in some cases. There are people who just feel like they need a break, and maybe they want to talk about the virus, maybe they want to talk about other things, and so we're just opening that line for people to talk with us about whatever it is. And also trying to work with JCPS on helping to help parents who are trying very hard to navigate right now. It's a little bit overwhelming. You've got all of these things happening, you're trying to keep your family you know, fully intact and healthy, and then also trying to manage this online system in some cases for the first time. And so JCPS is going to partner with us to talk with some of our Street Academy parents, and I'm sure we'll expand that. We kind of practice on our groups first, and then we'll let it go out into community. So we've got a lot of wonderful things happening. We're going to start some TikTok competitions and some art competitions and things like that online on Instagram in some of those places, so we can make sure that we're engaged. And even these young people that we see out occasionally not doing exactly the right thing. I drive through this city all the time, just like I know you are, Mayor. Maybe not right now, but you always are out there, and and others are out there all the time. And most of these young people are doing exactly what they're supposed to do. They're doing exactly what they're supposed to do. And what happens is on social media, we kind of see the worst of it. And so we think that's where what everybody's doing, and it's not. And but we do want to make sure that all understand how important this is and how serious it is right now. We'll get through it, but we just have to be smart about it. So I'm really thankful. I'm very, very thankful for just the opportunity to serve at this time. I think we all are chosen for a time such as this. And just like you have been chosen and I have been chosen, we will help our community get through this. And I'm thankful for you, Teresa, at Metro United Way, for the work that you do and how you help us to move this community forward.
Well, thank you, Sadiqo Judge. And
Thank you.
there's so many things to look forward to as we get on the other side of this. And one of those will be the opening of the indoor track and field facility in the Learning Center. So I'm looking forward to that kind of stuff. So keep up the good work while we're going through this, okay?
Thank you, sir.
All
Thank you.
right, thank you.
Mhm.
So this is really what the One Louisville COVID-19 Response Fund is supposed to be all about, is helping great organizations like the Urban League, the 16 other organizations that we just announced a few moments ago, and then there'll be many more as well. So everybody in our nonprofit community, thank you all. Your business is tough on the best of days, and here we are now going through some pretty tough days as well. But I know that you've got the heart and the grit to get through this, and we'll be there for you. I do want to say too, there's another guy in the community who is not that long a Louisvillian, but he certainly has been here to be called a Louisvillian, and his wife definitely has been here, grown up in the community to be a great Louisvillian, and she might be one of the reasons why this guy's here. So I want to say thank you to Coach Chris Mack from the University of Louisville for helping raise our awareness about what everybody should be doing in the community. So let's hear from Coach Mack and see what he has to say.
Unprecedented times like this define a community. Louisville, we are a compassionate city. While you're at home practicing safe social distancing, I hope you'll consider donating to the One Louisville COVID-19 Response Fund. You can do this by simply going to the link louisvilleky.gov. That's louisvilleky.gov. Thank you for your partnership, and remember, we are One Louisville.
All right, Coach, we're glad to have you on the team. Thanks for helping us out. And so many people came together on this One Louisville Relief Fund, really in a super quick period of time. Showed great entrepreneurship. So again, thanks to Mason Rummel, the James Graham Brown Foundation, Tricia Finnegan, thank you at the Community Foundation, Teresa Reno Weber at Metro United Way, Ashley Parrott, internal to Metro government, really helped knit all this stuff together. And then Matthew Barson, who stood up and said, I want to help. and Matthew has a great ability to make things happen from a business perspective and fundraising perspective. So $7.5 million, folks. That's pretty darn good. We're going to be able to help a lot of people. Let's keep going more. There really is unlimited need. So thanks, everybody. Great progress. Okay, let's switch over to something else. Like we'll act like normal times. Okay, in normal times, I want to talk about the census. So while COVID-19 is affecting all of our lives, the 2020 census is underway. And that's as important now as it was before COVID-19, because what the census results do, they determine our funding levels for federal grants as well as resources for schools, drives a lot of business decisions in terms of where companies are going to locate, where they're going to grow. So we got to have everybody to be counted so we get our proportionate share of resources. So that means every neighborhood and every age, every background. And so it's really important that we get the word out about the importance of the 2020 census. And there are a lot of ways that you can help, including a contest that could be a great outlet for creative people who suddenly have time on their hands. Today is the first day of the Louisville Census Digital Action Week. So everybody should have time on their hands, more time than they did before. So you got time to fill out the census. I'm joined by our city's census coordinator, that's Catalina Cordova. And Catalina is going to talk to us about how we can get out the word for the National Video Challenge. Catalina, thanks for joining us today.
Thank you for having me, Mr. Mayor. I'm super happy to have the opportunity to talk to everyone that is joining us today. And we are actually also happy to launch the Census Digital Action Week. And this is going to happen all this week through March 30th, all the way to April 6th. So we are asking everyone that it's at home, quarantine, or if you are able to do a video and participate on our social media. We have Twitter, we have Instagram, we have TikTok, as Sajikwa mentioned. People are going to be creating videos. So what better time to create a video, creating awareness about the 2020 census? So we are going to ask people to follow us on Facebook and Twitter. And then if they have created a video, they can go ahead and post it there. But the best thing about this, it's also a national challenge, a national video challenge that was actually put out there to create more awareness, because we are kind of forgetting a little bit about the census. So there's going to be 3 prizes. The first one, the grand prize, it's $3,000. The runner-up, it's $10,000. And the student prize, it'll be $10,000 as well. So we are asking for people to create a 30-second video and explaining the importance of the census. And they can go to challenge.gov to get all the information as rules, what needs to be done, what needs to be included, what cannot be included. And this is great because everyone can actually participate.
All right, thanks, Catalina. And remind us, who are the people that are most often overlooked in the census that people forget to count?
Yes, well, we have actually 5 hard-to-count populations, and that'll be children under 5. So I would love to see a video out there that includes the kids at home, the kids that are in school, video schooling. Right now, I think that would be awesome if they could create something like that. So children under 5 are undercounted. Also, any immigrants, our immigrant community, it's usually undercounted. Our senior citizens are also hard to count. So I would love to see a video from each and every one of those hard to count populations. African-American males, believe it or not, between the ages of 18 and 25 are hard to count as well. So we are asking everyone in Louisville to participate.
All right. Well, thank you for the great job. And remember, everybody, there's 3 ways to complete your census form, and they're all super easy. You can go online at my2020census.gov. That's what my wife and I did before she was COVID positive. It took about 10 minutes or so. Or you can return by mail. or phone at 844-330-2020. And remember, the census is available in multiple languages. So thank you, Catalina. We appreciate your good work.
Thank you.
All right, let's switch over to some more good news we have today. We received the news today from the Community Action Kentucky that the Home Utility Assistance Program called LIHEAP, which is the Low Income Home Energy Assistance Program, has been extended through April the 30th. So what that means is it's a 30-day extension from the original deadline of March the 31st. So it gives more time for everybody who's eligible for the LIHEAP assistance and is in need of payment assistance for their utilities to apply for this program. So here locally in Louisville, it's our Office of Resilience and Community Services that administers LIHEAP. So for more information, visit our website at louisvilleky.gov and search LIHEAP, LIHEAP, or call our automated information line at 991-8391, 991-8391. So between this extension of LIHEAP and the fact that LG&E has suspended shutoffs during this crisis, that should mean that everybody in our city can count on having heat and energy available to them while they're spending much more time at home. Okay, so more good news there and more attention for our Office for Resilience and Community Services. A lot of people have never heard about that office before, but they are really rising to the occasion during this time of need for so many. So I want to say thank you to Tamika, Laird, and the team at our Office for Resilience and Community Services. They are busy, busy, busy right now. Okay, another announcement. This is a health-related announcement to help you and help our first responders. I mentioned that our doctors and medical professionals earlier in this presentation today. So we need to do everything we can to make sure that they have everything they need to help us get through the crisis. And so that's also true of our MetroSafe professionals who receive the 911 calls. So one way their jobs has changed since the beginning of this crisis is they now have an additional script of questions for people to call into 911. If they have the time, based on what your situation is, they're going to ask you the following questions. If you call and say your house is on fire, they're not going to ask these. We're going to get you help right away. But here's the questions that we're asking you right now to deliver better service and keep everybody safe. They're going to ask you, do you have any of the following symptoms? Do you have a fever? Are you coughing? Are you having difficulty breathing? And have you had close contact with someone with COVID-19 or flu-like symptoms? So you can probably figure it out. The purpose of these questions is to slow the spread of the disease. The more information we have about people who have symptoms, the better off we are here. So, and we do know some folks on the calls have expressed concerns about these extra questions. But again, this is how we want to keep our first responders safe. We want to keep our hospital personnel safe and to keep you safe if you need a first responder to come to your house. So that's what all this is about. So just please take those extra few seconds to answer those questions. Be patient. It's good for all of us. And let's keep in mind that our 911 call takers, just like our 311 call takers, are working under very busy conditions that can be a little stressful sometimes, especially if we have stress on the other side of the line. We all deal with that the best way we can, but we can all do our part to make things easier for everybody. So I want to thank our 911 and 311 call takers. They operate out of MetroSafe. Again, unsung heroes in our community. So thank you all very, very much. All right, let's talk just a little bit about mental health before we hear from Dr. Lori Kaloya. We want to talk a little bit about mental health every day because, you know, it is only normal, as we've been saying, for you maybe to feel a little stressed right now or feel a little anxiety. The world's changed a lot. So if you're a little uptight about it, just know that that's normal, okay? Nothing wrong with it. It is a stressful time for a lot of people. And that's why I want to keep talking about mental health, and it's just as important as physical health. So just think about a coping strategy. If you're feeling a little uptight, go into your breathing routine, or do a good nice stretch or something like that. Or if you've got that special friend that you want to touch base, give him or her a call, whether it be on the phone or using email, but kind of have a routine to figure out, what it is you want to do when you're feeling a little bit stressed. Because the bottom line is everybody in the world right now is dealing with COVID-19. So we all are sharing a common experience, unlike probably anything that's really happened in the world. So you can talk to most everybody, and they're going to have some kind of story, and maybe that'll help you relieve some of your stress or some of your anxiety. Now, if you feel like you need to talk to somebody outside of your friends and family circle, that is like perfectly okay too. I mean, however it is you feel like you need to have a release. So there's an option there if you want to talk to somebody outside of your circle. Many therapists now are doing phone and telehealth consultations, and the U.S. Department of Health and Human Services has established a disaster distress helpline. And you're seeing that now on the screen. It's for people who need mental health and emotional support during the COVID-19 pandemic. And they can help you deal with stress and anxiety. You might be feeling depressed because of this virus. So again, look, we've made a lot of progress in society dealing mental health issues, just like we deal with physical health issues. There's nothing wrong with you. Okay, you're just feeling a little stressed. So talk to somebody and try to talk it out and get your routine going to help you there. That'd be a good move to make. So this disaster distress helpline is toll free, and you can talk to a trained crisis counselor 24 hours a day and get support for emotional distress related to the challenges you're facing as a result of this health crisis. Okay? So call that helpline if you feel like you need it. 800-985-5990, or text talk with us, text that to 66746. All right? We're all in this together. We want to get through it. Good physical health, good mental health. Let's support each other. All right. And remember, it doesn't cost anything to smile. So that always lifts people up a little bit as well. All right. Speaking of somebody that makes me smile, Dr. Lori Kaloya. She is doing a great job with our Department of Public Health and Wellness. She's our medical director. She's always competent, always caring, always compassionate, and ready to help folks out. So, Dr. Kaloya, how about an update from you?
Sure thing. Thanks, Mayor Fischer. I just want to thank you, Mayor Fischer, for talking about the 911 calls, and just reiterate that those questions that the callers are asking, or that those who are answering the phone are asking, are there to protect both our first responders and people in the community. If our first responders get infected with COVID-19, then there's going to be less of them to help take care of everybody in the community. So we need to keep them safe, and those questions can help to ensure that they're wearing the appropriate protective equipment when they do show up to take care of you at your home. So please be patient and know that they are following national recommendations when they're asking those questions in order to protect themselves and protect future patients and citizens like yourself. Today, I'm going to talk about some changes that we're implementing at the Department of Public Health and Wellness. And up until now, we have been following the same procedures for COVID-19 that we do for any of our communicable diseases. We've been tracing the contacts and monitoring home isolation for patients who have been identified as having COVID-19, and then also for their household and other close contacts. Thanks to many of our hardworking staff at the health department and many community volunteers from the medical community for stepping up to help our epidemiology and communicable disease team, we've been able to keep up until now with the influx of cases for some time. Now that we're having increasing in community spread, we've reached the point where the Centers for Disease Control, the CDC, recommends that we change our procedures. So other cities in the state who face the same challenge, such as Lexington, have already implemented these new procedures. And so we just want to keep you informed as to what you can expect. If for some reason you might be someone who has been exposed to COVID-19 or infected and are case of COVID-19 going forward. So as before, when someone does test positive for COVID-19, we will continue to complete an individual case investigation. So that means someone from our communicable disease team at the health department will contact you, and they will ask you a lot of questions about when your symptoms started, what types of symptoms you may have, and then other questions relating to the illness. At the continued request of the state and the CDC, the state health department and the CDC, we also will continue to monitor people who have been diagnosed with the illness. So if you are diagnosed with COVID-19, you may have someone reach out from our team on a regular basis to check in on you, see how you're doing, and make sure that either you're recovering or if you have been hospitalized, just to check in on you and see how things are going with your illness. So hopefully none of you will be infected, but if you are, don't be surprised if you are getting these calls from our staff at the health department. They're working really hard every day to continue to make these phone calls. As the number of cases increase, again, as I mentioned, we're going to be reducing the amount of contact tracings that we're doing, and I'll talk a little bit more about that in a second. One thing that we get frequent questions about from people who have been infected with COVID-19 or who have been told by their provider that they think they have COVID-19 and that they should stay at home or self-isolate. So I just want to go over some of the criteria that we look at to determine if individuals should remain at home and when they can be released from what we call self-isolation. So when you can leave your home after you've recovered from the illness. These criteria, in case you missed them and can't keep up with me, are all listed on both the Centers for Disease Control CDC website as well as the Kentucky Department for Public Health. Their website has similar recommendations listed as well. For those who have laboratory confirmed COVID-19, who have symptoms of the illness, they're ordered to take care of themselves at home and have to remain at home on isolation until the following criteria have been met. And there's a couple different criteria that we use in order to decide whether you can return to the community or not. Right now, that probably doesn't mean a whole lot because no one should be out in the community. We should all be at home, staying away from other people and keeping our distance. But in the future, if you are identified as someone who has COVID-19 and have had symptoms, then in order to be released from home isolation, you need to have been recovered for at least 3 days or 72 hours before we would even consider letting you back out into the community. So when we say recovery, that means you don't have a fever, even without medications that help control your fever, such as ibuprofen or Tylenol. We also want you to have resolution of any gastrointestinal symptoms. So some people have had gastrointestinal symptoms like nausea or diarrhea with this illness, and we certainly want people to have those symptoms resolved as well before returning into the community. For those who have a mild illness and recover relatively quickly, you have to have had at least 7 days pass since the time that your symptoms first appeared and the time when we released you from isolation. So if you get sick today, even if you're better tomorrow, you still would remain in isolation until a week from today. So a little bit confusing and complicated, I know. That's why we're here to help those people who have been identified as cases to know when it is time to go back to work, but these are, or to get out of the house even. But these are some of the things that we consider when we're making these decisions. Other places, and perhaps we'll have the ability to do this in the near future as the ability to test continues to get better and better in the community, but for those who have had laboratory confirmed diagnosis of COVID-19, we want you to have the same resolution of symptoms that I already mentioned, but then also you can be cleared to be released from isolation if you have 2 negative COVID-19 test results, and those have to be laboratory confirmed. They can't be office-based tests, and those have to be at least 24 hours apart or at least a day apart. Right now, I can tell you the vast majority of people are not going to be able to meet this criteria because we are trying to reserve as many tests as we can in the community for those people who are sick with symptoms and we're trying to diagnose with the disease or the illness. But at some point in the future, that may be a criteria that would be used in order to let people be released from isolation sooner. For those who have had confirmed COVID-19 but who never had symptoms, that's a little bit confusing. Most of you are probably thinking right now, most people shouldn't be tested if they don't have symptoms, and I would agree with you on that, but there have been several instances where this has occurred, and there may be instances in the future where this might occur. And in those individuals, if they have a positive test, then they should not discontinue home isolation until at least 7 days after the last known positive test. So if I get a test today and I test positive for COVID-19, even if I never develop symptoms, I need to wait at least a week before I can be released from isolation in my community. Of note, healthcare workers have some additional restrictions as well, and I can tell you we've been working closely with different healthcare systems in the community, and they are continuing to follow the Centers for Disease Control guidance and watching those carefully as far as if any of their employees are infected, they will know exactly what to do and when to allow workers back into the healthcare setting, and then also what precautions those workers should take in that instance as well. The other thing that I mentioned earlier, that we are going to be going away from what we call contact tracing. So in cases of COVID-19 up till now, we have not only interviewed the case or the individual who's infected, but we've also asked them to identify close contacts. So friends, relatives, coworkers, those individuals that they might have been around frequently. And we have certain criteria for who meets that close contact criteria. But going forward, because of the limitation of resources and the time it takes for each case, as well as those contact tracings, we will be asking those individuals who are infected to notify their close contacts themselves. So we'll be providing resources to anyone who is a confirmed case and asking them to go ahead and reach out to their close contacts and let them know, hey, I've been infected with this. The health department gave me this guidance to share with you. And the guidance is what we have been sharing from the very beginning. If you have been exposed to someone who has COVID-19, you would want to self-quarantine for 14 days, monitor yourself for symptoms of COVID-19, and reach out to your healthcare provider. Let them know if you do develop symptoms, and they would be able to help you get a test if it's appropriate for your situation. For those of you who haven't heard those recommendations, when I say self-quarantine for 14 days, that means that you should remain at home. You should not be going out in public. Even the social distancing that we recommend, if you go to a park and stay 6 feet away from people, we really would not want you even doing that. If you want to go in your own backyard, as long as you're by yourself, you can do that, but we would not want you going to the park or wandering around the community, potentially exposing other individuals. For those who do have confirmed COVID-19 disease, just so that people know kind of what the process looks like, we talk with the individual about what home isolation means, and then we also provide a legal order for them to remain on home isolation. So we typically have had people sign those orders electronically so that we don't have to expose staff to individuals who have COVID-19 disease. And in rare cases, we have had people deliver those orders for in-person signature. I already mentioned our new process for self-notification to close contacts of those who've been identified as cases of COVID-19. For individuals who are hospitalized, who are severely ill, or for some other reason may not be able to notify their own contacts, we would certainly make every attempt possible to go ahead and notify those contacts to the extent possible as well. And then, as you can imagine, virtually anyone who we have as a case may have gone to school or have been employed at some point, and so we would certainly be looking at when the last time of exposure was in those locations and ensure that we're providing appropriate advisories to those locations. So, for example, if there's a person who's identified as having COVID-19, we would send a notice to their employer basically outlining that they've had someone that works at their facility who has the infection, offer suggestions about how they can protect their employees as well as clean the environment. And these are all things that we have been sharing in an ongoing way, both through the media as well as on our website, as well as on the Kentucky Department for Public Health's COVID-19 website. Those resources have been available for quite some time now, so we'll probably be telling people a lot of things that they already know as far as employers go. Individuals, as you can imagine, with the home isolation are excluded from the workplace, and then we also certainly recommend that employers are monitoring their employees that are coming to work, those people who are doing essential jobs. We really want them to be able to keep the rest of their employees healthy. So certainly if an employee states that they're ill, or if there's concern that they're ill, excluding them from the workplace can help protect your other employees. We have expected the rise that we're seeing in the COVID-19 cases locally, and we have been seeing community transmission for some time. So we're not surprised that we're having to go this route. We have worked as hard as we can, countless hours to try to keep up those contact tracings as long as possible, but understanding that we have finite resources, we're using those to the best extent we can possible, make sure that our community is informed, that those people who have been diagnosed with COVID-19 know exactly what they should do, and trying to share that information with the rest of the community so that they know if they get a letter from a friend or coworker or colleague that says, hey, I've been exposed to COVID-19, or you've been exposed to COVID-19, I'm infected, you know, they know to expect that, and they know exactly what to do when they receive that from their friend, family member, or coworker. We will be continuing to focus many of our efforts on healthcare workers, first responders, and other essential personnel as well. So we're not canceling all contact tracings, but we are going to be limiting those to those cases in particular.
Doc, that was fabulous advice there, especially as more and more people are getting impacted. Obviously, their questions, okay, when can I get back in action? So
Exactly.
We'll see those in our media brief, I'm sure. So those numbers are going to be second nature to a lot of people. So thanks for sharing that with us, and for all the countless hours you guys are putting in. I want to go ahead and jump over to a couple of questions we have for the media, and one of them is for you, Dr. Kaloya. And
Sure.
asking you to talk about the impact of an N95 expired mask. How long does it take to expire? And is an expired mask better than no mask right now while PPE is low? That's from Tyler Emery from WHAS.
That's a great question, and we have certainly received a lot of donations, and then identified that there has been expired PPE, particularly the N95 masks were one of our main concerns. And what the most important thing is when it comes to PPE is that it is in good working condition. So we have advised that people are inspecting their masks, whether expired or not, making sure that they are in good working condition, they don't have any physical defects in them that might make them ineffective. And so those are the main things that we're looking at. The expiration, kind of with some medications as well, we've learned that, you know, those are set to be safeguards over time. And so looking at our own materials that we have in the state that we've been getting from the stockpile, if there is anything that is expired, certainly we believe that that is going to be effective as PPE. Things that we receive as far as donations from the community, certainly if there's boxes that are opened, you know, we scrutinize that a little bit more, and not that we're not using those things, but certainly we are, you know, if we're getting things right from the stockpile or from a manufacturer, we feel a little bit more confident in that rather than something that might have been sitting in someone's garage for some time and has the potential for environmental breakdown. So.
Okay. And I just hope we don't get to the spot like we're seeing in New York City and other places where this would be a high-class problem for them to have. I mean, they're literally running out of everything. So we're continuing to grow our inventory so we prepare for our surge. So thank you, Dr. Cloy. Appreciate you. We got a question from Chris Otts from WDRB, and I'll ask Connie Mendel. Hopefully she can get on the line here in a second. She's with our Public Health and Wellness Department as well, a different category as it relates to business inspections. So the question from Chris Otts is, I understand the Health Department toured GE Appliances over the weekend. Photos indicate some makeshift social distancing efforts, including plastic barriers that look like shower curtains between workers. Did the Health Department sign off on GE Appliances modifications? And is the Health Department comfortable that Appliance Park is a safe environment to limit the spread of COVID-19? So, Connie, are you on the line?
I am. Can you hear me?
Good. Yes. Thank you for joining us.
Yeah. I did tour the facility on Friday. I walked my 5,000 steps during that visit and saw the manufacturing areas and the check-in areas. So they have instituted a lot of new practices just for the incoming shifts, and that includes screening of staff. They have a list of questions along with temperature, and that is for employees and visitors. They've spread out and cut down the amount of people on the assembly lines and has installed large plexiglass barriers between many areas. Just applied different cleaning practices, spread out break rooms. They went over a lot of the procedures as far as staggering breaks and cutting the number of people along the line in some areas as many as half. So, we talked about medical practices and procedures and the isolation room that they have in place if someone does get sick and the nurses on staff. We are continuing to monitor any calls that come in from 311 and any concerns. So this will be an ongoing investigation throughout, and we'll be following up with any of those concerns that we receive.
Okay, I understand. Did we receive a call today?
We have received two at the end of the day. One actually involved a sewage issue, so that has already been resolved. But yes, so we will be, I'm sure, out at the plant this week.
Okay, good. Well, appreciate your good work on that. And, our job is not to define what essential businesses are. The Department of Homeland Security does that. So GE is in that category. Obviously, we're trying to tell people to stay home. So working appliances are an important part of that, and keeping food fresh, et cetera. And so we've been in contact with both GE management and then the union, the IUE. I know they're all speaking with each other. So obviously the goal is to have, first off, a very safe, healthy environment and a productive environment. So we'll continue to play our role, which is helping on the public health and wellness side. So Connie, thank you to you and your team. Okay, that's all the media questions we have. So I'll just close out by saying, remember about Lift Up Lou. So you can go to kind of develop your rhythm of the day. There's multiple things happening throughout the day, so we all have our routine. Tonight, we're closing out at liftuplu.com or at liftuplu on social media at 7 p.m. with a mindfulness session put on by the Passionist Earth and Spirit Center. No doubt Joe Mitchell is in the middle of that. So if you want to get a little mindfulness and relaxation, you can do that 7 o'clock tonight at liftuplu.com. So remember, if you have any questions about COVID-19, go to kycovid19.ky.gov or call 800-722-5725. And I want to close out tonight with a special shout out to a friend of mine. I doubt if he's on here, but his name is Merv Albisman. Merv was profiled on page 2 of the Courier Journal today for his many contributions to the field of journalism. President of the National Association of Black Journalists back in the day, broke the color barrier at the Courier Journal when he was an illustrator, and then he went to report on the social disturbances of 1968 in West Louisville. So Merv is heralded around the world for his work, and I was really glad to see how he was featured in the Courier Journal. And he always says one thing when he's ready to sign off when we say goodbye to each other, and I'll say that tonight. And here's what Merv says. He just says, "Keep the faith, babe. See you tomorrow, 4 o'clock."